World of Dentistry. Dental solutions for your dental needs. Teething rash. Welcome to our video. If you are expecting a new baby or have a newborn, you have probably realized by now that teething is a difficult time for both parents and babies. However, a symptom often occurs during this process that is not directly related to teething, a skin rash. In this video, we will talk about the teething process in babies, the common symptoms that occur, and how to prevent a skin rash. First of all, it is important to know that temporary dentition begins around 6 months of age, with the eruption of the first lower central incisor, and lasts until around 3 years of age. Common teething symptoms include swollen gums, restless behavior, poor appetite, and difficulty sleeping. However, a common symptom is excess salivation, which is what causes skin rashes. When a baby begins to erupt its teeth, it is an exciting time, but it can also be distressing for parents due to the symptoms that accompany the process. One is a skin rash. A skin rash is essentially irritation or eruption that occurs on the skin of babies. It is associated mainly with the accumulation of saliva around the mouth during the teething process. The rash appears as red or discolored patches, and in some cases it appears cracked and the skin has a dry appearance. It is important to mention that the teething process itself does not cause a fever, but if the baby has a fever or his crying is louder and more frequent than usual, it is best to consult a doctor since the fever may be associated with infectious processes caused by bacteria or viruses. So how can we prevent a skin rash? Although it is not possible to completely prevent drooling, there are measures we can take to help the baby with the discomfort it causes. Some recommendations include regularly cleaning the skin around the baby's mouth with a damp cloth, avoiding the use of scented creams and lotions in the area, and keeping the baby well hydrated. In addition, some specific products can prevent skin rash during the teething process. For example, there are special pacifiers designed to help soothe sore baby gums. There are also specific creams and lotions to relieve baby's skin irritation and help reduce the risk of skin rash. Another important recommendation is to make sure that the baby is receiving a balanced and adequate diet. A diet rich in vitamins and minerals helps strengthen the baby's immune system and reduces the risk of rashes. In case the baby develops a skin rash, it is important to keep the skin clean and dry at all times. It is recommended to avoid putting tight or synthetic clothing on irritated skin, as this can worsen the condition. It is also vital to avoid scratching or rubbing irritated skin, as this can cause an infection. It is important to remember that a tooth eruption rash is a common and temporary symptom and generally does not require medical treatment. However, if the symptoms are severe or if the skin rash does not disappear after a few days, it is advisable to consult a pediatrician. In summary, a skin rash during dental eruption is a common symptom in babies. However, there are measures that parents can take to prevent and alleviate the symptoms, such as keeping the skin clean and dry, using specific products to soothe the irritation, and making sure the baby is receiving a balanced and adequate diet. If you have any concerns or questions, do not hesitate to consult your pediatrician. That's all for today. We hope this video has been useful to better understand today's topic. Don't forget to subscribe to our channel for more information.